yentem. And now we catch us or your men's movement member. And then we hear Natari Shemua over to me at the dance say ampa or your member. Na means every crano, yen fan sembo, and share yen yen software, or your software AIWC, or software Dr. Isaac Dogor, Evra, or Nien, Ebabedin Komoi. Osofo, you are welcome. We are all ears for you. Man of God! Man of God! Mean up! Action! 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 Na.
I am so happy to be back this week. I enjoyed our discussion in the previous segment. I believe that we've all learned one or two things that we have started working on as far as our bodies are concerned. I'm still waiting for some of you to visit us in the clinic so that you can have that thorough medical checkup and it will help you for the rest of the year. Today we are looking at our kidneys. Our kidneys. Oshe hunam na yewo muna. Enano ye kan akuma se akuma ye engine. Ene ye she kidneys no. Organs na ewo body ni muno. Utumi hu se ebi hu hia pa. Inti ye ta celebrate World Kidney Day. Every March on the 12th of March is World Kidney Day. It tells you that the kidneys are so important. That is why the medical world would decide to set a whole day aside so that we can talk about the kidney for people to know how important it is. Inti enne ye kidneys the way a ebua unamno and at the way a yebefaso abo ye kidneys mobile. Now, kidneys no obia wo kidney 2. Kidney no sha kidney phonia. It is a beans. The way a beans tieno. That is how the kidneys actually look like. Now, they are very small if you look at the body compared to the size of the kidney. They are very small. And they are usually at the back. They are towards the back. The kidneys are towards the back. Under the rib cage, the last ribs, you see the poles of the kidneys hiding under the ribs behind. Okay. Now, some people may not have 2 kidneys. Somebody can come with just 1. That is natural. And then some people too have kidneys that are not in their right positions. You see them in the pelvis. So pelvic kidneys. And also natural. Most often, whether it is just 1 or pelvic kidneys, once there is no problem with it, it should be able to function very well. We want to first look at how important the kidneys are. Kidney. Dien kra na kidney no eyema body no. Now, the kidneys probably are one of the most important organs in the body. Ye environment. Ye taka zoom lion for hunsem. Ena rubbish edos dodo. Ena gata nomu omampra. Ena waste ewo city nimu. So one of the key things that the kidneys does for the body is to be like the zoom lion of the body, to clear waste out of the body. A lot of things that we eat, we drink, medicine that we take, a lot of them have to be cleared from the system after we have used it. And it is the kidneys that act like the sieve. Nti kidney no etise sonye a soni efi ye mojem. That is one of its key roles. In fact, apart from the kidney, only few other organs do some form of excretion, like the skin. The skin actually excretes water, which the kidney is the major excreter. But with skin, also to me, ensue excess water from the body. But excretion is a function of the kidney. Ye can BP hunsem in our previous discussion. The kidney is the main regulator of blood pressure in the body. Inti se ye nyina ye wa ha ya ye measure your blood pressure almost measure ye say wo kidney no ena control wo blood pressure. Kidney no to me release chemicals be a good system no mu emma body no signals the way ebe control BP. Inti, one of the things that happen to you when your kidneys are damaged is that almost always you will develop high blood pressure. Inti, that is one of the functions. It regulates blood pressure. And your moja level, blood level, obi beko hospital, you see, or anemia. You nim say red blood cells no, dompenu. Marrows na ewo dompe no ehona na red blood cells no fi. But kidneys no ena emma sa bone marrow no signals and sana what me produce blood cells. Nti one of the things that again you see in people who have kidney issues is that they always have very low levels of blood. They be just a warm erythropoietin ana ye ma mo mojedro and now transfusion because kidney no assay. Na important nansan utumi say nipa p per supplements. One of the things that we like so much is vitamin D supplements, calcium supplements, those things. The body actually in our environment does not need those supplements if your kidneys are very well, because the kidneys actually regulate vitamin D production. In the tropics, where we have a lot of sunshine, the kidneys can use the sun's ray to make sure that your body have enough vitamin D to make your bones very strong. And these are some of the key things that the kidney does for us. Blood pressure control, filtering the blood and removing toxins, helping us in producing blood cells, and also helping in vitamin D production. Until to me say kidney no who here pa. In fact, moja na ewo ye body ne mu nyina. If you look at the size of the kidney and the amount of blood that it receives per minute, you realize that it is a very important organ. About 25% when your heart pumps blood, about 25% of them goes to the kidneys. It tells you how important the kidneys are. Now, yenka statistics kakra. Let's come to Ghana and look at the issue of kidney disease in Ghana. Yahweh who say, ufa mpenyufuo ewo Ghana, 100 people, 13 of them have some kidney problem. 13. Nti uyi nipa 100. 13 people out of those people have some kidney problem. Now, about kidney problem, the reason why we are so concerned, particularly in Ghana, is the age group that usually have the kidney diseases. We have realized that it rather affects the most productive age group, which is between the ages of 20 and 50. Most of our kidney problems are in this age group. That is why it is very important that we talk about it. Because if you look at it, that's the most productive years for anybody. 20 to 50 years. Unfortunately, most of the kidney problems are within that age group. And we also realize that men in Ghana have more kidney issues compared to the women. That is why this is very important for us as men. Maybe as we go on, you come to realize why the condition is more common in men than in women. Again, statistics wise, Oshe kidney disease prevalence ewo Ghana. Now, who compare with the average for other countries? Yeah, they know ewo sro a chain. Other nations are omotwa ehwansia. Globally, the average prevalence of kidney disease is about 10%. But Ghana's statistics stands at about 13.3, which means that more Ghanaians have kidney issues compared to the average that we have worldwide. That is why we have to pay attention to our kidneys. Now, you see kidney area, edi empana, edi kidney area eba. Yeah, friend, assassins. We call them twin assassins. Yeah, assassins are usually trained specialists. Yes, send you on special mission. They do it so well that usually they don't leave traces. Nipanu wenwana etuona kano. Wana eshutu ye. Yenim. Ntina ye from assassins. Eba kidney problems are. There were two conditions via ye from assassins. Baku eye moja bruso BP. The second major one is diabetes. And when you come to the statistics globally, we are saying that these two conditions, high blood pressure and high blood sugar, these two conditions alone accounts for 70% of all kidney diseases worldwide. Let's come to Ghana. When you come to Ghana, we are saying that 39.9, almost 40% of all our kidney cases are linked to high blood pressure. 4 out of 10 kidney patients in Ghana, the problem was because they have high blood pressure that they didn't manage. And we call these two conditions assassins because they are silent. In our previous discussion, we said that high blood pressure, high blood sugar, they are conditions that usually will not give you any signals. So if you are watching your dashboard, you may miss it. Unfortunately, they are the major causes of kidney disease in Ghana. Then we have other causes. Last discussion, herbal medicine issues came up briefly. And today too, we are faced with the same herbal medicine issues. Now, we know that 35% of acute kidney failure in Ghana is from herbal medicine. And you will now begin to understand why kidney disease is more common in men. When you look at our consumption of herbal medicines in Ghana, you see that the men mostly go for the concoctions that they tell us boost our strength as men. Vitality. Inti abochi enam krom okrani bottle wabubu enwure bia gum ena akpete kakra ka ho or the camphor too na obo sa glass no ko ofa ye dan echi a na ya frɛ abochi ye pe power inti na ya tobi. Those concoctions account for about 35% of all acute kidney failures in Ghana, and we must pay attention to them as we talk about kidney health. If you have problem with erectile issues, please, the solution is not the bitters that they sell out there. If you come to your hospital and you go and see those who take care of men's health, and you tell them that you have a problem with erection, they have ways of managing them so that you don't go on drinking the concoctions just in an attempt to have some enhancement, which most of the time is very transient, which means that every time you have to be taking such preparations in order to be able to do what you are supposed to do as a man. Herbal medicine. And then we are talking about the contaminations. These days, issues with galamsey, contamination of water, contamination of our food, heavy metals, and all these things are going into our system. And they are contributing to the increasing risk of kidney disease that we are seeing in Ghana. The other thing that we talk about when it comes to kidney health has to do with diet. Again, last week we spoke about salt. And if you remember, we said that salt and hypertension are related. So, if you eat so much salt, what you are going to do eventually is that you would cause your blood pressure to go up. And like we have seen, blood pressure is a silent assassin when it comes to kidney disease. Inti udi nchini no na ama umoja blood pressure no akosro. U blood pressure no nso kosro na wa nhwe so yi a echire no ebema u kidney no asay. So we stress again when it comes to kidney health that let's watch the diet, salt, and most of the things that we put in our food, like we have shared some time ago, has salt contents. The kobe, the momoni, the seasonings, they have so much salt. And the more we indulge in them, the likely we are to have blood pressure issues that will eventually lead to the damage to our kidneys. Then hydration. Nsio ayenum. And I know you can say, one numu nsio kra no a day. Ubenum about 3 liters of water. If you starve your kidneys of water for a long time, the kidneys will eventually fail. So how it starts is that you may have an acute failure. If that acute failure is not corrected, then it moves on to total failure. And water is important. Apart from you drinking enough water, any time that for a reason you lose so much water, ebia when you diarrhea, uyema cow, we DBB and to uyemi. Sebio na uyema shiesa ana wa fisa obi to me fisa na wa yemrem. At that point, because you are losing so much fluid, what happens naturally is that the blood flow to the kidneys will reduce. Normal, the body will try to readjust the fluid distribution. Until once you are losing so much water because you are vomiting or you are having acute diarrhea, mojana as echo kidney no kidney arteries no ebe shrink so that other parts of the body can use the blood. Ebanusa na one replacement no adequately. Udi ebe ya say diarrhea no etwa wakoto edro ewo drugstore Imodium one they say the diarrhea no etwa ana vomiting no etwa, but one rehydrating losses na ekoye no one to me and share naimo ye at this time but u kidney no issue about few months later ube say they say the kidney no agini ho kra. Any time we lose water, please make sure that you rehydrate yourselves adequately. And we always say unya diarrhea was that and I will fit 5, 6. Say obi to me traffic or say my fee be 20 times. And then now be trained for the 20th time before you decide to go to the hospital. Once it is becoming too much that you cannot replace the fluid the way it is coming, you really have to go. Most of the time, what do? We put fluid on you. Is to protect your kidneys. There are other things that can give you kidney problems apart from hydration issues. They are infections, HIV, viruses, kidney problem. Nipa be HIV, they are at higher risk of developing kidney problems. If you have hepatitis B, hepatitis C, your risk of developing kidney problems are high. We know in Ghana that most of the people who have to go for dialysis, at least 3.9% are people who have these infections. Either they have HIV or they have viral hepatitis. Screening, no. These things have to be part. Once a year, general screening, try and do these viruses as part of the screening, so that if you have the infection, they can monitor and see whether some form of treatment can be given so that your kidneys are protected. Unya kidney area, how does it show? We had them who say, "Hey, Bia, dear me kidney problem abahu." The first thing I will say is that please don't wait to begin to see signs and symptoms of kidney disease, because by the time you actually begin to see the signs and symptoms, it means that you are almost at the end stage of the kidney problem. Say the kidney ajini hukra. Intina wastati ehu eniyamabi ewo body. So kidney disease is one of the things that we don't watch the dashboard for. You have to be doing your annual checks. And anytime you do an annual check, kidney check is one of them. We would rather admonish you to do the kidney function test rather than wait for symptoms. But if it happens, what are some of the things that you are likely to see? A key one is the swellings. And most of the time, if it is a major organ, it's both legs, not one leg. It starts usually with just the ankle area. Ube say apeja kakra ukoda na usoria nopa na atwi. As you go through the day, na swelling naba udi unsa emia na atom. Mesremo enye kidney disease nkwa enebetumia amanabasa, but it is one of the main conditions that can give you swelling. Then you can actually see some changes in your urine as well. Ebia uko junso afide junso no eye foam. And now the color is not the usual yellowish color that you see when you are dehydrated. It's dark colored. It's a Coca-Cola. Dark colored urine. When you begin to see that, know that there is a problem with your kidney. Obinsu onanti kakra wabre. So the person gets tired easily. When he walks a little, he's panting for breath. Why that is happening is that now u kidney no and to me enyi excess water no enfi u body no. Inti nsuo no ekota u chest, u lungs no. Inti uya de kakrape na wakuma ete. I say to me humi unanti kakrape na ubre. So when you are getting easily fatigued and you are seeing these signs of swellings of the ankle, please pay attention. Your kidneys may just be giving you signals that they are failing. So how do we prevent kidney problems? You see, unim dia ediba, it means that you can actually put a stop to it. And we have looked at the assassins of kidney disease. We have mentioned two of them, the critical ones. One is blood pressure, and the other one is our blood sugar. So it is about monitoring some of these risk factors. monitoring your blood pressure. Again, we will keep stressing that blood pressure is silent. Blood pressure bet to me in the excess of 200, and you will feel fine. Nothing will be happening to you as far as the way you feel is concerned. Your head is not aching you. You are not feeling dizzy. Nothing. That is why such people, when they by any means get to the hospital or a pharmacy and they check the blood pressure and they tell them your blood pressure is high, or say no, mini BP. BP, no, and signals. The way out is to monitor it. Then you have to look at your diet. You can and be once mainly salt. When it comes to blood pressure and kidney disease, salt is what we talk about. And we looked at the foods that are very high in salt content. We must manage our diet. Then some medications. And not be offer for a long time. Orthodox medicine. We any herbal keke. We made orthodox medicine. And not be offer for a very long time. One shot. Ebeha kidney. Mainly some of the painkillers. Until uyobia, because of one reason or the other, utafa painkillers a lot. You have to be careful. I always say generally that if you have to take painkiller, probably the safest is paracetamol. And no dear, affect your kidney. But generally, uko top painkiller ewo drugstore. Na ya mao painkiller no box no. Ya drawing the power so. Na nipa na so ni kon. Ana wa so nechi. Ana wa so ni nine. All those types of painkillers are not healthy for the kidney when you use them for the long time. They are NSAIDs. We call them NSAIDs, non-steroidal anti-inflammatory drugs. And they are very good when it comes to pain relief. Nti ubebi yo ya na ukoto sadro na onuma within an hour ube say why you fine. But if you take that medicine repeatedly over a long period of time, o kidney no ebe shut it down. Nti please be careful. Apart from the herbal medicines, the pain medications that we take over the counter, let's watch them because it may affect our kidney. Nti midi kidney hunsem no eba wiye no. Ese hunse kidney no enhu hia pa. Sebio ya yenim obia wenya kidney yare a se sei yesi onkoye dialysis. Yenim issues no. It is not just about the money. Look at the age group that I just talked about that usually have this kidney problem. 20 to 50. Dialysis. You would virtually waste your time most of the time in the hospital. You are either going 2 or 3 times a week. You are always tired because your blood levels will be very low. So it is not a disease that we should wish for ourselves. And the way not to wish it for ourselves is to make sure that we protect our kidneys. The way to protect the kidneys is to make sure that we check our blood pressures, we check our blood sugars, we drink fluids as much as possible so that the body is well hydrated. And above all, we continue to do our checkups so that we can find the issues very early and help the body to recover. In the year point, the Amidibe Tratwell and he said, Upe se ubo kidney ubaya. Se unyanya appointment this year for health checkup. This is the time to do it. Walk into a hospital, walk into a wellness center, let them do a body check for you, and as part of it, let them do your kidney function test. So that if there is a problem, they can direct you to the experts who will help you to manage the condition. Thank you very much for your audience. We will now take questions.
Man of God. Man of God. Mean up. Action. 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 No. Mausembium. Wow. Ya shira. Yapomudinti. O ewale namo ewo ni Dr. Dogor kewo wie mene. So asembisa ebrenini. Pacho mo asembisa no peja mo sana mi hwe ebeji first 3. Oh, obi kita mic ni dada. Enti uwia na waba na unsu waba na fe yato aso. Pacho yenko.
Men of God.
Be strong in the Lord.
Ya tena krasi pen no. Ya hu say symptoms are okeka ye no mu bi. Ebi no afaso awu pa. Na krasi ni superstition. Enya ba pe de ba yetirimran so obi abodidua. Ana owafuo kase enti obi di adura kogum wati aso na enya no. Enti minim se edaso koso wo baabi. Esan se program eye TV so enti no ye nim baabi obi behwe a ode bete yenka. Enti se eho no obetimi address ho yi aman na ode afutu ama wo mu. Na afa nso mema ye wa ha no. Metimi aka se half of us. And I'm more than half.
To me, Ben, I'll declare.
Say, make a year over here. Your dashboard, no. A so hypertension or mine. A so BP on check it. Name a blanket, change the oil. Change the oil. A hot and favorite pa.
Eti,
meaning say. A shebi no mutirim say o change oil na ahoden ba engine no more than any other thing. Eti me say we a aye kidney asemi. Change the oil no and so mata oho ana. Na you who say how often we should change it, not how moderate it should be. Me da say.
Men of God,
be strong in the Lord.
Radiasi and enchechire no ya no mi se yahwera de bebre na doctor mpese mi bisa se say kidney ene pressure no a o cheche yen anadudidie etumi di sa ne man so ba na we say mi didi say yem bebro ho a yadwuma ni nti no aya ye no fie ntem edu fie so aya for so say ye bedidi eno e the problem bre na we da say
you
men of God. Today we've claimed that BP and then diabetes are the most cause of kidney failures. The kidney fights hard to take out the waste product. But I would like to know what part that the pancreas play to help the kidney function, or the kidney play together with the pancreas. Thank you.
Doctor Dase, I'm saying, okay, in kidney, no. Tito no kasafa salt. Na, nimse said abra red meat na de no so. Ota oyobia intake ne dose no so ha. But I'm saying, okay, say na menti bi amfa that side no only salt. Minimum bin so salt ya kan ho asem. Ono so to medical every morning be offer salt be there down one be. Now the gunsuo mu one no musa o say doctors no omunima ade salt no eye de maye. Na wo mo mpese ye be hunu enti no mo se me endi salt. Na sani pa no so healthy. Na I don't know say
ATM. You dog.
Okay. So, in fact, salt is one of the most dangerous things to the body. Don't let anybody confuse you about it. Research has shown that, especially you have asked why I haven't spoken about meat and other things. When it comes to blood pressure, the most important food item is salt. Meaning say, me when I was very young, very young, my grandmother went to the hospital one day and came back. And then they said, yes, I've grown before I now understood why those days they tell people not to eat salt again. Those days, as soon as you have BP, they will tell you don't eat salt. It is because we know that salt makes it very difficult for you to control blood pressure. So there is no confusion about it. These days we don't say that because of the advancement in medicine, we don't actually say don't eat salt. We say reduce the quantity so that you at least you can taste your food. It's because the medicines are so effective. But salt and BP, no two ways about it. Now, red meat does not cause kidney failure. Okay? Again, let me say that nobody says you cannot eat meat. People stretch some of these things. Yes, would 50 years mending meat. There's nothing like that. Everything is moderation. Everything is moderation. Until 60 years. Now, so dear, uberi meter, or to marry meat. Just do it in moderation. It does not cause kidney issues. That is what I will say. Now, your issue with our people in the rural areas is not strange. In fact, this week, earlier last week, somebody showed me a picture of one of our church members whose legs, the two legs, are swollen. So all the way to the knee, both legs. And you realize that omudi nyamabia they put some things on it. And they say it's spiritual. Now besides say any pay our BP, almost I our BP. Offer BP a drone. I know they are to me. Now I'm saying this one, two things. Either the person's heart has failed or the kidneys are in trouble. And yet, sebio, and yet spiritual asem. I was telling them, say, let the person go to the hospital so that they see which of the organs is failing. Because you can be helped. Nti yemma asem no enko ye frefre ye nuanom ebusuafo nom ewo rural areas na eya nkomo ne mu no ye nkeka we enchiro. Say some of these things they shouldn't over spiritualize it. We are Christians. By all means, when you are unwell, whether it is headache or what, you should pray. But after you have prayed, go to the hospital. Because if you go to the hospital, there is some help that you can get with that. And yes, if you have two legs swollen, is one of three things. Either your kidneys, either your heart, or your liver. Those three organs are the key organs that control fluid. Until once you see both legs swollen, it's one of those three organs. And if you go to the hospital, they will be able to tell where the problem is. Then they can help the people. So let's educate our brothers in the villages so that they visit the hospital instead of attributing everything to spiritual forces. Then somebody says something about checking the engine and kidney failure. You see, one of the things that we have realized, which is very common, those who are opened, the patients that are opened, they will tell you, when they come to the hospital, the men, and they have high blood pressure, and you want to put them on blood pressure medicine, the first thing they will say is that, we have heard that if you take the BP medicine, it will take your gun away from you. That is the concern. Those who are free with you would say it. Others won't say anything, but in their minds, they will not take the BP medicine. They say, and they'll tell you something must kill a man. They would rather go to the grave with their guns than lose it. But this is this is actually the truth. High blood pressure in itself can give you erectile issues. Blood pressure in itself can give you erectile issues. Until you may decide that you will not take the medicine, it will not solve your erectile problems. That is why you would have to be taking lawyer, going to Abochi for those their concoctions, which will eventually give you problem. We know that some of the BP medicines actually affect erection. That one we know. Okay? But it is not everybody. It's individual. So in selecting blood pressure medicines, we select medications based on individuals. So most of the time when you go, they will tell you that this medicine, when you start it, this one, you may have headache. This one, you may have blurred vision. This one may affect your erection. If you go and you experience any of those symptoms, come back and tell us. BP medicines, BP, different. The only thing is that some work very well. So we would always want to start with them. It takes your gun away. If you come back and tell us, say, so that you don't go off the medicine trying to save your vitality and end up getting a stroke. Obeko akwano now akonya stroke. If the medicine gives you any issues, please just go back to your doctor and let him know. Say, Edrono, when I started, it's affecting my vitality. So, now, with the pancreas, when it comes to the pancreas, the work of the pancreas mainly has to do with insulin production for sugar control. Pancreas, no, and also ye organ be a body no. Ne juma titri ewo enyuma fufura eye. But the key function of the pancreas, and it's a producing insulin. Say more diabetes, more insulin. Usually in diabetes, what happens is that there's a problem with that insulin production of the pancreas. It's either say pancreas no or producing insulin, but on producing dodo and now on producing cra. The pancreas produces insulin that helps regulate the blood sugar. And we have seen that if you don't control your blood sugar very well, you can have kidney disease. So that is the link. Thank you.
Night eating. Obika, late night eating.
Yes, late night eating does not directly affect kidney health. What it does is that it makes you put on weight, which is a risk factor for both hypertension and diabetes. So you can see the loop. The more you eat late, the more you are likely to put on excess weight. And as long as your BMI is going up beyond what it's supposed to be, your risk of developing high blood pressure and diabetes is high. That is why the late eating is not advised. I know very well that most of us work and get home very late. Generally, it's a problem. But we always say that look at it. If it is possible to get a good lunch in your workplace, then eat your heavy meal at work. So that when you get home, you don't go and eat that bowl of fufu at 9 p.m. You get something lighter. Otherwise, you end up putting on a lot of weight, which would go a long way to worry you health-wise. So, late eating, no? Enye my body. Thank you.
Amen. Epacho, ebe yaro emre bi kakra. na me be yare no me be honhoye me nasi me nim me nsa me ko hospital afi na me ya pa ba na omo check me so omo hu hwe nti doctor bi na me call review emre bi na onya me ho adaje tena me ho nti obisa me ade eye me en me kire no nti obisa me na me se miti na that time ni miti na me ya pa ti ni basa miti mi yi miti ni nyina but yes still na emu hyehye me nti obisa me se ebasa me ye den na me se me num dibido na so tini ya oya pa onum dem si dibido na no kwemu ma no ma che nti eba no na onum me se no na me onum a ye oden am so me num a ebrase e ma mitimi da ena o se eno na a create kidney amame. In fact, or can't kidney asemono. Minima de kode craw, but the way I know my messia yeno. Maybe if you be soon ye. Na I say, me near ni da so be a beam. But Miss Sanchez me whom crying. To me bomb me software money, then Pastor Braco, me district pastor, our kono. See, ye shall say bompire. The review time is so me call. Review time so me call. Ya me text a whole be brave, but me could be a semi report ne call na. Ya listen mammy fofro. By ye mammy drew. Ya be mammy fofro. Ye mammy drew. I drew the mammy. I'm lady pin. BP a drew. Inti ya be 3 days be. Ena me be who such I say. Bibia like me. Who no. A call. Nti the next hospital I miss her coin. And oma mami mu ai bia na papa ka kire me say wo ho ato. Nti say na man feel team. But me starting say me num BP edu no. Na me hu say my released. Me seminanti ha ne ha. Me bre metimi atena ase. Be 30 minutes ansa na matoa ekwan so. But me starting say me num BP edu no. Bibia be rai. Amen. But me kidney no. Me be jai hospital no call. Me son started say me call. Me son call and doctor be a or share me no. Oka him say chronic disease. And kokra but se si ade omu hu yare no. Nti ade a me ya me maintain no. Me maintain we no. But kidney no me te say ekum nkrofo. Yet me 3 years ni a ade ni ye me. Menti bibia kan biem enti pressure ne duro no se edemaya ye no mimitimi ho se eno na me no ma eboa me amen.
Yesi se obinya kidney na yesi bia asai na ansa na obeye no so acha woko outside na mpese mbusa se kidney nu na yentimi nya wo Ghana a yentimi nya ne Ghana na se omo beye no na yentimi enyacha outside asani akwakoye kidney no
pacho besen bisa se lower pressure blood pressure ho ana na se also a den na yebe ya ebetumi boosting up amen.
Yo ye mame asem na okan no is actually a summary of the presentation. Wa my symptoms and a one my the entire ohunu ye BP no ka ho and a gibido e diclofenac ne paracetamol no macabum. It tells you the risk factors that we are talking about. So I think that is a good buttress for what we have discussed. Now, kidney disease, no, let's be clear. Like I said, a lot of people have kidney disease. But it's not everybody with kidney disease that will end up with dialysis. The kidneys are resilient organs. In fact, you can survive on probably a quarter of a functioning kidney. So by the time we say go to dialysis, it's a long time. The person may have had the chronic kidney disease is in stages. Very
Chika
long
no
time.
condemn. Wachini condemn.
We're trying to condemn. And the good thing too is that, say, earlier stages of kidney failure. Now, one or more. You can actually, if it has not passed, you can actually reverse some of the damage and slow down further progression, like she has done. Now she's taking the BP medicine. So, very likely, the progress of distraction will now be off because the blood pressure now is controlled and she's not taking the medicine that may have been compounding the issue. So that is why we have to take the medicines, control the numbers. Because if we do, the distraction can be slowed down. Dialysis point. People have chronic kidney disease and Sebio, something else killed them, not the kidney. We just have to make sure that we take our medications. Now, kidney donors. Ghana is now putting up legislation and other things to regulate how these things are done. It's not like we don't have people in Ghana who can give kidney. We have. But really, the legal framework is not there. Like happens in some of the countries that they have been going to. Illegal harvesting. Obi yari wanya appendix. Obeko hospital akoyi na appendix. Obe sorry no. Na sebio yayi kidney ni baako onim. Later on kra obeko akotwa scan na esi u kidney ni baako ye hu. SEC ewo other countries, and we have to make sure that there is regulations before some of these things can be done. And I'm sure that gradually we would get there. As for the personnel to do the transplant, now we have them in-house. And once those things are put in place, there shouldn't be any problem. The last one was on low pressure. Yes, some people generally have low pressures. In fact, we call them special patients. And if you are one of those people, you need to know yourself, know your pressure. Generally, you see, the normal blood pressure is anything, the top one, 100. 100 is normal, even though we mentioned 120. But anything from 100 all the way to 120, it's fine. But some people's blood pressures are lower than 100. And it is normal. It's their normal. Into Obi Beba Hospital, Obi Chichirin in Sana, ni pressure 85 something. One show ye na unye experience as a health professional. Na wako ye the NSS ubeye. Because in your attempt to help that person, you will harm the person. You have to know your reading, your normal reading. If your pressures are generally low, uko hospital pe uko tenancy pe nurse ni ba ka chen say me pressure generally e wo fom. Yes sir, on measure na ohun wan hwe onye experience odinsuo be si usu sese a. Na sansuo no e be flood wo lungs if your pressures are generally normal at very low levels. So know whether your pressure is generally low or not. If you have low pressure, we don't usually treat it. You don't need to treat it. If your pressures are generally low, we don't treat. People will tell, go and take salt. Because we say salt raises, num nchininsu. We can say num coffee. Debbie. If your pressures are generally low, that is your low normal. It's fine. Before we would treat a low pressure, you must be having clinical symptoms of low pressure. The key ones are the dizziness that comes with it. The person feels lightheaded. So generally, if your pressures are around 120 normally, and for a reason, ABI is so dehydrated and it drops, you see that the person is lightheaded, very tired easily. When it happens like that, we treat it. And there is a way we treat it. If you have low pressures and you know that my readings are generally low, in fact, if you reach the hospital, let them know. Because I have seen such instances in the emergency rooms where people attempted to correct low pressures and they ended up flooding the person's lungs with excess fluid. Nipa na aba ono ananti aba any low pressure into no buy. After the wabedani emergency. I saw that hospital for this. So just know your numbers. If yours is low, that is it. There is no need to treat it. Thank you very much.
You don't fix what is not broken. Man of God! Man of God! Mean up! Action! 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 No. Wow. It's been another great time talking about our health. And this time it is our kidney. Your kidney. And our kidneys. And that body. Mejidi say yati bebre na yedi efutuo no ebeye ejuma. That's ene yebesai ababium na yenimu abedi nkomo. Katre obi na ono so katre obi say men's palace die edrusa ebre no a eni kwan se oye ne ho efrimu efi se eye ebre a ehyeda eyesi ho edika emema asem ene insema efa mema ho ne insema ebeboa emema na yetumi atenase ayedi a onyankopon epese yeye edi asida ebema yensofo Dr. Isaac Dogor na esan ada yen sofo Apostle Emmanuel ni okule tete a odi asalom down asori dan mu emma yen ene empenyifo a eka ne ho nyina men's movement executive national executive yebeda your sponsors asi na afi ada Tag TV crew asi bebrebe. Tag TV is the official television station of the Apostolic Church Ghana. Maya diepa se mudi sa program yi ebreye na yeni age se yenso ye kahubi na sa program yi aye successful. Me ahimfiechi ami the linguist of the Men's Palace, Pastor Enoch Atutonu. Dasene yebesan share biom. Men of God, men of God, mean up. Action! 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 No.
Tag TV, belting the globe with the gospel.
You won't believe her response. Really? It was a big no, my sister.
Someone so
Eh?
I'm crying. I'm Hey, this is just the tip of the iceberg. Let's get into a comfortable seat. I want to hear you. I want to hear more. Please, let's go.
Hey, Namo Benjamin.
So how can we get to hear more of these interesting stories? Just join the Ladies Lounge. Ladies Lounge? Oh, more to be told. What is it about? Ladies Lounge. Hey, baby, you're discussing my home. Hey, I want